as a vrana. That's one of the definition. But at the same time, there is another of the definition. Vranoti asmat rudhopi vranavastu nanashati adeha dharanat tasmat vrana ityuchate bhaihi. Anything which produces irreversible changes in the body, and the stigma of that lesion is continuing for the whole life, such a condition is called also as vrana. So you have two basic definitions of vrana. This is not to produce more confusion about it. The issue is to differentiate between the consequences of the injuries to the body. See, that's exactly what we now study under the two heads of acute wound and a chronic wound. Of course, acute, both the wounds are wounds only, where there is a discontinuity of the surface of the body. But in an acute wound, it may heal with the same tissue of its origin as such, and that's this also called as sadhyavrana. We'll come to that later issue. So a wound may heal without any permanent changes or without any irreversible changes, and some of the wounds, they would result in a situation where there would be a lifelong stigma or a scar formation. Now that's about the basic definition of the vrana. And now, even now, we have that kind of approach to the definition of the wound as acute and chronic wound. Chronic wound is usually considered as a wound which takes long time to heal, or doesn't heal at all, or it may recur. But from Ayurvedic point of view, the word vrana has some more broader meaning than simply of the vrana as such. In the context of Shatkriya Kala, Sushruta has used the word vrana bhava as such. That's in the last Kriya Kala, Bhedavastha, when any disease which results in a situation where vrana bhava has been occurred, vrana bhavam apannanam shashta kriya kalaha, it could occur in any of the other diseases. It's not only about the wound. Even in any other diseases, either systemic disease like jvara atisara pravritina, or localized disease like vidarika, etc. In any of those conditions, there would be a stage where there could be a stigma produced. Now, this is a very important pathological concept. A disease healing without stigma and a disease healing with the stigma. Stigma is when the healing of the disease, any lesion, occurs through any tissue other than that of the original tissue which was supposed to be there, the parent tissue. Such a condition can result in a situation where the evidence of the disease is left over in the body for the whole life. Now, this kind of a situation is what we call as the vrana bhava, a irreversible complication. Like when it is about the jvara, a febrile condition, it could be any of that. A fever which is produced as a result of any infective pathology. Maybe take the example of typhoid. In case of typhoid, a good number of patients may result in a complete recovery without any evidence of these damages. But many of these typhoid conditions can result in a carrier stage where the organism can be left remaining in the gallbladder, and that person may remain as a carrier. That's the vrana bhava. Or a typhoid patient may have a neurological deficit, and he may have some maybe blindness or maybe deafness and so on. That's also the vrana bhava. Or so on in case of a colitis, if a patient has an atrophy of the mucosa of the colon, that too is the vrana bhava. So the word vrana has a much broader meaning than that of the simply wound, though in majority of the conditions we consider vrana and equivalent to the wound. Now, as far as now, we will limit ourselves, our discussion to only the wound equivalent to wound as such, vrana and the wound being similarity or synonyms like, but we have to have this clear-cut concept that the word meaning of vrana has a much more broader meaning than simply of the wound. Now, from Ayurvedic point of view, this is a very classical and a very standard approach of classifying the vrana wounds into two, shariraha, agantuha, agantushta. The agantu vrana anybody can make out easily. That's a wound which occurs due to an external injury. But a wound occurring spontaneously is a unique Ayurvedic concept. That shariraha is a concept as such where a endogenous pathology or some other previous lesion can result in a wound as such. It could be due to like a inflammatory pathology which is produced and then inflammation resulting in the wound. Now we will have some more discussion on this issue when we discuss about vrana shofa in the later context. Now the difference between the current concept and the Ayurvedic concept is in the current concept, inflammation is a result of injury to the tissue. So only when the tissue is injured, there will be some inflammation, and that inflammation may result in a pyogenic consequence, pus-forming consequence, and a pus-forming consequence can disrupt in the tissues, and hence a wound could be formed. But from Ayurvedic point of view, of course, there is a lot of similarity. I'm not suggesting that there is a dissimilarity. From Ayurvedic point of view, the inflammation may occur only when there is some abnormality of the dosha. The physiology is altered, there could be some inflammation, and that inflammation may result in a wound as such. So the issue is, it's not about the inflammation which needs to be tackled, but the cause for the inflammation, which could be the dosha situation, which needs to be tackled and which needs to be targeted. To highlight that issue, Sushruta has made the classification of a sharira vrana, which could be produced due to pavana pitta kapha shonita sinipata nimittaha. The wounds could occur due to the abnormality of the doshas in the body. And of course, aganta vrana, it's quite obvious, right? It could be due to any physical or chemical trauma, or it could be due to the natural energy like the lightning or so on. Now, in all aganta vrana, once the wound occurs, the consequence of the wound, once there is a wound, there is an injury to the tissue, there will be reaction of the body, and that reaction of the body to the tissue or injury is called as inflammation. And the word inflammation, the meaning of word inflammation is catching fire. Now, that's exactly what Sushruta has said as a Kshata Ushma. It results in a situation where the temperature will be raised, and hence the primary approach is to prevent that temperature being raised. In the sense, inflammation needs to be prevented. That's the basic idea. So hence, in all agantrona, tatkarameva kshatoshmanah prastasya upashamartam pittavita shita kriya avacharanam vidhi. So in the initial stages, once there is a wound there, it has to be treated with the shita kriya. Application of either cold in the sense, either it could be shita virya or shita sparsha. It could be cold to touch, or it may be having the shita virya as such. It may produce that shita guna in the body. Such of the substances are to be used in the treatment of the vrana before there is a inflammation or before there is a vitiation of the doshas. Now, we need to understand the consequences of the vrana under these three stages. The first stage, where there is no inflammation, pre-inflammatory status of the wound, then there could be an inflammation, and the inflammation resulting in an impairment of the healing process. That's the dushta vrana. Now, this kind of a staging, a sadhya vrana, that's where the wound occurs, and then immediately you have an opportunity to prevent this inflammation, or kshata ushma can be prevented. Or there will be a stage where will be kshata ushma, that's the vrana shofa. We'll come to that vrana shofa later. We'll discuss more about the vrana shofa later in the later part of that. Or it may result in a vrana which has a wound which has the dosha vitiation, dushta vrana. So approach to the wound management will be depending upon the stage in which the patient has come to you. If it is immediately after the wound, the approach to the treatment will be shita kriya or sandhana. Sandhana is again, the word sandhana has a different sorts of meaning. Of course, in Ayurvedic literature, word sandhana has many other meanings in general. In case of Rasa Shastra, the sandhana is fermentation. Leave all that. In the context of Shalya Tantra itself, sandhana also has different meaning. Suturing of the wound or bringing the edges of together, approximation of the edges of the wound also is called as sandhana. Or application of a kashaya rasa over the wound area so that the bleeding can be prevented. Hemostasis, establishment of a hemostasis or prevention of the bleeding from the side also is called as sandhana. So, in the context of the vrana, the word meaning of sandhana has both these meanings, establishing a hemostasis as well as approximation of the wound edges would be the primary target of the treatment in a fresh wound. And then once it is done, then to promote the healing, madhugruta prayogaha, madhugruta application of honey and ghee or any other such local medications with an idea of promoting the healing is the approach to the treatment. Now, as far as the Sadhyavarana are considered, that Sadhyavarana are the possibility of assessment of a acute injury. Once a patient comes with an acute injury, how to assess that? And plan the management. To give that detailed approach, Sushruta has classified the Sadhyavarana into 6 categories. They are Chinna, Bhinna, Vidha, Kshata, Pichita, and Ghrishta Varana. And this has a very perfect rational approach as such. Now, word Chinna or Chinna Varana is तिरस्तीनं ऋजुर्वापि योर्नश्च आयतो भवेत् गात्रस्य पातनं चापि छिन्नम् इत्युपदिश्यते. Any of the wound which results in separation of a part of the body, gatrasya patanam, a part of the tissue is separated, that's considered as a chinna. Now, a rationality of identifying this as a separate category of the wound is, see there you will have a significant tissue loss. So one is in an excised wound. Even now we categorize this as excised wound, where a part of the tissue is separated. There will be a tissue loss, and that tissue loss may not be possible to be made out. You need to either ensure that the stump is healed or stump is closed, the approximation of the wound is achieved with the loss as such accepted. Or now you have another choice, the lost tissue may be compensated by or may be rehabilitated, the reconstruction may be possible. So you need to approach to the wound with these 2 ideas. The first is whether there is a possibility of rehabilitation or the graft of the tissue. If it is not possible, then try to achieve a healthy stump as such. Now, another advantage of a excised wound is the tissue which is lost, but the stump of the wound, such. In that condition, the characteristically the discharges would be Sarpik Prakashaha, Sandraha, Shvetaha, Pichilascha. You will have a discharge which looks like ghee in the sense the adipose tissue, the fat tissue. So fatty substances, either it could be the infected pus or it could be even otherwise non-infected fatty substances may be leaking through, and then you decide like it's limited to the adipose tissue plane. So Mamsagata as such. So clinical assessment of the wound is based upon the clinical examination as such. Siragataha, in case of involvement of a vessel, now when Sushil says Sira, it's not only the vein, it's the blood vessel. Again, another of the controversy often seen. Now, in case of the Siragata vrana, when there is a vessel is involved, then the obvious evidence will be either Siras Rakta Atipravutihi, where there could be a excess of the blood loss and hence the signs of shock could occur, or Toya Nadi Viriva Toya Gamanam Puyasya. You can see a continuous flow of the blood from the vessels. Now, if there is an arterial injury, it's more important that you will have immediate correction so that the amount of the blood loss is more, and establishment of that hemodynamic status, blood pressure or so on, and then if there is a need for replacement, you may have to replace the blood or maybe replace the fluid. So that formula of maintaining that hemodynamic status that needs to be applied if it is an arterial injury. Whereas in case of the venous injury, there will be a passive continuous flow. The blood loss is not the primary issue. I'm not saying that it's not an issue. It's an issue still. But quantity of the blood loss is not a immediate primary issue. It's not producing the emergency. A simple local compression would be enough to stop that bleeding. That's what Sushil has mentioned as a Toya Nadi Bhiva Toya Gamanam. Either it's Rakta Atipravutihi in case of the arterial injuries, or in case of venous injury, a continuous flow as such. In a continuous flow produced due to the vessels, it could be simple local compression. Whereas in case of an arterial injury, either as a first aid, you may have to have a tourniquet which is having a pressure beyond that of the systolic pressure to stop the bleeding as a first aid, or you need to go for a direct intervention like either the ligation of the artery or maybe cauterization of the artery. Whereas in case of a venous injury, a simple local compression bandage would be often enough to stop the bleeding. Then, of course, whether there is a need for direct correction of the vessel or not, that depends upon the extent of the damage and the location of the vessel involved. But a first aid primary approach in case of an arterial injury and a venous blood loss, arterial blood loss and venous blood loss would be slightly different. Tourniquet which you use in case of a venous injury would be always a low pressure tourniquet, whereas in case of the arterial injury it will be high pressure tourniquet, and a high pressure tourniquet cannot be kept on for a prolonged period. It needs to be relieved once in at least 5 minutes, not more than 5 minutes, so that the vascularity of the tissue beyond the area has to be saved. It's also true that in case of an arterial injury, the maintenance of the vascularity of the distal area is a very critical issue which needs more elaborate assessment. Anyway, that's about the vascular injuries. Then comes the Snayugata vrana. Snayu, of course, are the connective tissue. I don't say it's only the muscle and the tendon or muscle tendon, everything comes under the Snayu. In that condition, the wound is quite deep and the discharges will be Singhanaka Pratimaha. There will be slimy discharges. It's not serous, slimy, thick discharges, suggestive of the tissue fluid leaking through, and that word Singhanaka is the phlegm which comes out, and that's also Saraktaha. So, assessment of these injuries of the connective tissues, muscles and tendons, is also another of the challenge. And approach to the management also is another of the issue. It's not enough if you have a visible wound healing. You need to ensure that the strength of the muscles and the function of the muscles are maintained to the possible extent. But of course, if there is a non-viable connective tissue, it needs to be the asthi becomes nisara, it becomes sequestrum. Shukti dhotameva abhati, it looks like a limestone, doesn't have that living component. And asravashchatra, madhyamishraha, sarudhiraha, snigdhascha, the discharges would be typical of the bony content. Of course, what we call as the teardrop sign is a characteristic feature. Sandhigate, if there is involvement of the sandhi or the joint, then in that condition, the characteristic feature would be the discharges which are produced as a consequence of the wound. It could be the blood or the pus. They may not flow freely, and their flow will be depending upon the position of the joint. When the joint space is reduced, either by flexion or extension, the flow will be better. And whereas when the joint space is lesser, the flow would be